Hey guys, welcome back to my YouTube channel. Today let us learn about stoma. Today in this lecture, I will be showing the procedure of stoma care. I will also explain what is stoma care, what are the indications of stoma care. Mainly the procedure I will be demonstrating. Complications of stoma. A stoma is a surgically created opening in the abdominal wall that allows waste, urine or feces to leave the body when the usual route is not possible due to disease or injury. Like you can see, I am doing the procedure, right? So in during that time you have observed that it looks like a small round pinkish opening on the belly, and it can be permanent or temporary. So why a person they have to undergo the stoma? The patient is unable to defecate or may need bowel rest via stoma. Then bowel obstruction, when there is a severe or recurrent obstructions like from tumor or adhesions, it may require a temporary or permanent stoma, so that they can through this process it can divert the stool. Then trauma or injury, if the patient is having trauma or injury in the intestinal part, or if the patient is having ulcerative or inflammatory bowel disease where the patient is unable to defecate or may need bowel rest via stoma. Then bowel obstruction, when there is a severe or recurrent obstructions like from tumor or adhesions, it may require a temporary or permanent stoma, so that they can through this process it can divert the stool. Then trauma or injury, like abdominal injury is damaging the intestines, may require diversion of bowel contents via stoma. In all these conditions, the stoma is required for the patients whenever they are having this kind of difficulties. Now, if we see why it is essential to do the stoma care, so the indications of doing the stoma care is include to prevent infections and skin irritations. Then proper stoma care will ensure the stoma bag, it will prevent the leakage and it will function properly. Then to maintain hygiene and patient comfort, it will also promote emotional well-being to the patients and reduce the coping mechanisms among the patients if there is any odor issues, means the smell issues, or if they have to live permanently with the stoma bag, that and it will promote psychological well-being to the client. So if we talk about the different types of stoma, so we'll be discussing in another video, so we'll not go for the types of stoma. Just let us know what are the articles required for stomach care. So a stomach care kit includes, so we need stomach bag pouch, right? So according to the correct type of the stoma and size of the stoma, the bag are used. Then adhesive tapes are used. Then base plate or the stoma plate are used. Then stoma powder or paste for leaks, for irregular skin, and for the stitches side, the stoma powder can be used. Then skin barrier wipes or protective film are used for maintaining the integrity of the skin. Then disposable gloves, and it is a procedure. You should remember that stoma care is not a sterile procedure, because the patients, after returning back to home with a stoma, the attendant of the patient or the patient himself or herself can do this stoma care, right? So here the nurses or the doctors, they will teach the stoma dressing and caring to the patients, and accordingly they can change their bed. Then mild soap and warm water, home settings they can use, or for removing the gauze piece and the bag, but in case of hospital settings, normal saline is used preferably. Then gauze or soft cloth to clean the area. Okay, then scissor to cut the flange to stoma size. Then disposable paper bag or biomedical waste bag, accordingly it is needed. I have washed my hand, and after washing my hand, so that it will prevent infections to the patients, then I have positioned the patient comfortably. So I have given the patient lying down position, And after that, I have put on the disposable gloves so that it will prevent hygiene and prevent infection. Then I have tried to remove the old stoma bag slowly, peeling the edge slowly from top to bottom and supporting the skin. Then I have disposed the used bag properly. The next step is to clean the stoma and surrounding skin with the help of warm water and a soft cloth. So I need to advise the patients when they return back to home, if the patient will do himself or herself the stoma, or if the attendant will do, they need to keep in mind to use warm water and a soft clean cloth. But now in the hospital settings, I am using normal saline solution, and after that I am wiping the stoma side smoothly, and I have pat the skin dry gently, and I had to avoid rubbing. Then afterwards I have inspect the stoma, where I have checked for color. It should be pink or red, the size, swelling, or any signs of irritation or infection. So in this client, the color of the stoma is pink and it is normal. There is no any complications, or the size is normal, the skin is intact, and there is no swelling or any signs of infections. Then after that, I have applied the skin barrier or paste, so it will protect the skin around the stoma from the leakage. Then again I have wiped the area with the gauze piece so that it will remain dry, and so that the stoma bag will get pasted properly. Then after making the skin dry, I have applied the powder. So I have applied the powder in the area wherever there is a stitches. Then again I have dried the area with the help of the gauze piece. Okay. Now the next step is to measure the stoma and cut the new bag accordingly. So the hole should be just slightly bigger than the stoma, about 1 by 8 inch or 3 mm. So accordingly I will cut the bag. So I have measured the stoma, and now I am about to cut the stoma bag. After that, I will attach the new stoma bag by putting at the center the opening over the stoma and pressing it gently over to seal. So how I have attached the new stoma, so I have to put the adhesive gum above the stoma bag. Then we need to place it and hold the bag in such a way for a minute, so that it will give a good adhesion. Then afterward I will put the adhesive tape so that the stoma bag, it will remain secure and it will prevent leakage. And at last I will remove the gloves and wash hands again, and I will discard the used items accordingly. Now let us watch the demonstration to understand the steps. Common complications may occur due to the stomach ache, like there can be skin irritation if proper stomach care is not done, and or if there is any leakage from the stomach ache, or if there is any adhesive, so skin irritation may occur. Then stomach retraction, so the stomach it gets sinks below the skin level. Then sometimes the stomach can get prolapse due to the pressure produced by the person who is having stomach, like forcefully coughing or doing or lifting excessive weight. So during that time also the stomach can get prolapse, so it get protrudes more than normal. Then sometimes peristomal hernia can occur. So during that condition, what will happen, there will be bulging near the stomach. Then infection is more common at the stomach or surrounding skin if proper hygiene and infection maintain protocol is not maintained properly. Means mainly the hand washing and hand hygiene if it is not followed, and if after 4 to 5 days if the stomach bag is not changed by the person, or if they are not managing the leaking of the bag, so during that time infection may occur. So it depends upon the hygiene of the person. Then bleeding may occur, especially if the person they get trauma or if they do harsh type of cleaning. So during that time bleeding can occur. And sometimes, not sometimes, maximum of the people they have a coping difficulty, or they are having psychological impact, depression or body image issues may occur. So for that the nursing personnel may play a very crucial role. They need to counsel the person before providing the stoma, right? Every aspect they need to explain about the disease condition, what will be the benefit of the person after getting the stoma, okay, the steps and procedure of doing the stoma care, everything they need to motivate the client so that it will decrease the depression or anxiety. So a tip for the healthcare workers as well as the caregivers and the patients whoever are doing the stoma, so they should always use proper hand hygiene before handling the stoma bag or after doing the stoma care. Then changing of the pouch regularly so that there is no leakage or there is less risk of infections. Then it is very essential whoever is doing the stomach care, they must observe for any signs of changes of color, shape or size, because again complications may further lead to suffer by the patient only. So changing the pouch regularly, like 4 to 5 days, and on the day 5th or on the day of changing the entire stomach bag, they need to bath. The person whoever is having the stomach, they need to take a shower, or they can take bath with the help of soap and water. Then observe for changes in color, already I have mentioned. Then we need to encourage the person to do open communications about the emotional health, because it will help the healthcare workers to identify the psychological effect or psychological impact on them, so that mild psychological effect can be measured, and further more complications will not occur, okay. Then we need to educate the patient on self-care and confidence. So that's about a short video regarding stoma care. So you all have learned about what is stoma. So when the person they need to undergo the stoma, and what are the indications of doing the stoma care. For the parts of the stoma bag I'll be explaining later. Even I'll be